Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Metabolic Syndrome. Introduction. Metabolic syndrome is a group of conditions that put you at risk for serious health problems, including heart disease and diabetes. The term metabolic refers to the chemical processes involved in the body's normal functioning. Healthy lifestyle changes are the first line of treatment for metabolic syndrome. Treatment may also include medicines. This program explains metabolic syndrome. It covers symptoms, causes, diagnosis, and treatment of the disorder. Metabolism. Food is made up of proteins, carbohydrates, and fats. Chemicals in your digestive system, called enzymes, break the food parts down into sugars, proteins, and fats, which are used for energy and building blocks. This process is known as metabolism. Your body uses sugars and fats for fuel. The fuel can be used right away. It can also be stored in your body's tissues, such as your muscles and body fat. Your metabolism may be affected by a change in the balance of hormones or enzymes in your body. You might have too much of some substances or too little of other ones that you need to stay healthy. When this happens, chemical processes do not happen normally. Problems with metabolism can increase your risks for serious diseases, including heart disease. But it is possible to prevent problems with metabolism, mainly with healthy lifestyle changes. Metabolic Syndrome. Metabolic syndrome is the name for a group of risk factors. These risk factors increase your risk for heart disease, stroke, diabetes, and other health problems. There are 5 risk factors that are a part of metabolic syndrome. These include a high triglyceride level, a large waistline, a low HDL cholesterol level, high blood pressure, high fasting blood sugar. A high triglyceride level or taking medicine to treat high triglycerides increases risk for metabolic syndrome. Triglycerides are a type of fat found in the blood. A large waistline is another risk factor associated with metabolic syndrome. Having extra fat in the abdominal area means a greater risk for heart disease than extra fat in other parts of the body. A low HDL cholesterol level, or taking medicine to treat low HDL cholesterol, is another risk factor associated with metabolic syndrome. HDL sometimes is called good cholesterol. It helps remove bad cholesterol from your arteries. A low HDL cholesterol level raises the risk of heart disease. Having high blood pressure or being treated for high blood pressure is also a risk factor. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood. High blood pressure can damage your heart and lead to plaque buildup. The final risk factor associated with metabolic syndrome is a high fasting blood sugar. Taking medicine to treat high blood sugar also increases the risk. Each metabolic risk factor can happen by itself, but they often happen together. You must have at least 3 metabolic risk factors to be diagnosed with metabolic syndrome.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Most of the metabolic risk factors associated with metabolic syndrome have no signs or symptoms. A large waistline may be the only visible sign. Sometimes this is known as having an apple shape. Some people may have symptoms of high blood sugar if they have diabetes. Symptoms of high blood sugar can include blurred vision, extreme tiredness, increased thirst and urination. High blood pressure usually has no signs or symptoms. However, some people may have dizzy spells, dull headaches, frequent nosebleeds. If you have one of the metabolic risk factors, check with your healthcare provider to learn if you have more. The more risk factors you have, the greater your risk of serious health problems. Always check with your healthcare provider if you have signs or symptoms associated with metabolic risk factors. Your symptoms may or may not be caused by metabolic syndrome. Causes. Not all doctors agree on the definition or cause of metabolic syndrome. Insulin resistance may be one cause of metabolic syndrome. Insulin is a hormone your body makes to help you turn sugar from food into energy for your body. If you are insulin resistant, too much sugar builds up in your blood, setting the stage for disease. There are also many factors that may work together to cause metabolic syndrome. Some of these factors can be controlled, others cannot. Factors that may be controlled include an inactive lifestyle, being overweight or obese. These factors may be controlled with exercise and a healthy diet. Risk factors that cannot be controlled include ethnicity, family history, growing older. Other health conditions may also contribute to metabolic syndrome. These include constant low-grade inflammation throughout the body, diabetes or a history of gestational diabetes, excessive blood clotting. Diagnosis. Your healthcare provider will ask about your symptoms and medical history. You may also be asked about your family medical history. A physical exam will be performed. Your healthcare provider may measure your waistline if you have an apple shape. A waist measurement of at least 35 inches for women and at least 40 inches for men is a metabolic risk factor. Blood tests can determine triglyceride and HDL cholesterol levels. It can also be used to determine fasting blood sugar. A high triglyceride level and fasting blood sugar level are both metabolic risk factors. A low HDL cholesterol level is also a metabolic risk factor. Your blood pressure will be measured to determine if it is high. A blood pressure of 130/85 or higher on more than one occasion is a metabolic risk factor. If only one of your two blood pressure numbers is high, you are still at risk for metabolic syndrome. To be diagnosed with metabolic syndrome, you must have 3 of the 5 metabolic risk factors. Treatment. The goal of treatment is to reduce the risk of serious health problems. These include heart disease and diabetes. Treatment often includes lifestyle changes. Medicine may also be helpful. Healthy lifestyle changes are the first line of treatment for metabolic syndrome. Lifestyle changes include losing weight, exercising and being physically active, following a heart-healthy diet, quitting smoking if you smoke. Your healthcare provider will likely recommend weight loss and help you with a weight loss plan if you are overweight. The goal of a weight loss plan is to lower your body mass index, or BMI, to less than 25. BMI measures your weight in relation to your height. Physical activity can help keep your heart and lungs healthy. Talk with your healthcare provider about the types and amounts of physical activity that are safe for you. A heart-healthy diet includes a variety of vegetables and fruits, fat-free or low-fat dairy products, lean meats, whole grains. A heart-healthy diet avoids or limits drinks high in added sugars, refined grains, solid fats. Smoking can raise your risk for heart disease and heart attack and worsen other heart disease risk factors. Talk with your healthcare provider about programs and products that can help you quit smoking. Avoid secondhand smoke. Your healthcare provider may prescribe medicines if lifestyle changes are not enough. Medicines are used to treat and control risk factors that include high blood pressure, high blood sugar, high triglycerides, low HDL cholesterol. Blood-thinning medicines such as aspirin also may be used to reduce the risk of blood clots. Excessive blood clotting is a condition that often happens with metabolic syndrome.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Metabolic syndrome is a group of conditions that put you at risk for serious health problems, including heart disease and diabetes. Most of the metabolic risk factors associated with metabolic syndrome have no signs or symptoms. A large waistline may be the only visible sign. Sometimes this is known as having an apple shape. Not all doctors agree on the definition or cause of metabolic syndrome. Insulin resistance may be one cause. If you are insulin resistant, too much sugar builds up in your blood, setting the stage for disease. A physical exam will be performed and your waistline may be measured if you have an apple shape. Blood tests can determine triglyceride, HDL cholesterol levels, and fasting blood sugar. Healthy lifestyle changes are the first line of treatment for metabolic syndrome. Your healthcare provider may prescribe medicines if lifestyle changes are not enough.
Thank you for using Explain.